Welcome back. You're with CNN News 18 this morning. Let me quickly go across and introduce our reporters who are joining us this morning. Revati is joining us from Bengaluru. Neetu Regukumar is joining us from Thiruvananthapuram. And all our other reporters are also constantly getting us all the updates from the various states in the country. We are at the moment on the story of the Nizamuddin Markaz that was carried out of which several people who've gone back to their respective states are now testing positive for COVID-19. What is the situation like and how are states planning now to arrest any further spread of COVID-19 within their respective areas? Let me go across first to Revati, who's joining us from Bengaluru. Revati, any updates that you've got this morning on this particular case?
Well, last night, the Home Minister put out a press note detailing the number of people who may have attended this congregation in Nizamuddin, Delhi from Karnataka. There were 62 foreign nationals who had attended this congregation from Karnataka, out of which 12 of them have gone out of country. Now, 50 of them are still in different parts of Karnataka. All of them have been quarantined. And a total of about 300 people may have attended this congregation from Karnataka is what the Home Department is saying. Now, tracing for these people have already begun. There are some of them who have been traced, identified and also quarantined. But the rest, this department is still in the process of tracing them. But they've also put out a notice for the public asking them to voluntarily come up for health checkup, voluntarily come out and reveal their travel information, in fact, if in case they have gone for this congregation. So at this point of time, the Karnataka government estimates that around 300 people may have attended this congregation in Nizamuddin in Delhi.
Neetu, I want to come back to you now because, as Revati is pointing out, and so have many other states done that. And of course, Kerala has been at the forefront of really fighting COVID, and in the past as well, we've seen them with Nipah taking utmost care, contact tracing. In this case, has a stern message been sent out that people should self-declare and seek help from designated hospitals in the state?
See, so far what we are understanding is that the government has got a list of people who have attended this meeting. At least 20 is been identified as what we are understanding at the moment. So the district collectors have made this list and it's handed over to the police. So they are in the process of getting all these people tested is what we are understanding at the moment. Earlier we were talking about the health facilities that are available in the state. So Maha, if you look at compared to the other states, we can say that Kerala is a little better placed when it comes to health facilities and identifying these issues, or even providing the protective gear to the healthcare professionals. So what has been said by the health department is that they have enough personal protection equipment at the moment, and they have made arrangements for the more procurement of this. So there will not be any problem at this juncture. Right now, those who are in the front line, what we are understanding is that if things go into the next phase, or if things are going to go through that line, what they do is that there are people in reserve who would be again put in the front line. That is what we are understanding is the plan is. Private hospitals, government hospitals, all have been made ready as part of this. In every district, there are hospitals which have isolation wards and more ventilators. They have already given orders for more ventilators and stuff like that. And buildings like hostels, abandoned buildings, abandoned where old private hospitals were running, which are not running now. All these have been taken over by the government.
All right, Neetu, Revati and Vinay are going to stay with us. Let me also quickly introduce two of our guests who are joining us this morning. Dr. H.S. Chhabra, he is the Medical Director of the Indian Spinal Injury Center, and Dr. Dimpi Mahanta, she's a psychologist. I'll go to both these doctors in just a bit, but before that, let's quickly listen into what the ICMR head scientist, Dr. Raman Gangakhedkar, had to say about this particular crisis.
So what about clusters? In fact, the one in Nizamuddin is being classified as the biggest cluster outbreak in India. Just give us an understanding of the situation there. Would you expect the number of cases also to go up given the kind of proximity these people would have come with each other?
Yeah, see, for all practical purposes, whoever is exposed, we should consider him as a potential case. Huh? He could come out as positive. That's the reason why you ensure that for 14 days you try to follow them up, right? Or ask them for isolation to be maintained for 14 days. So it is essential that all those who came in contact should be considered as those who can acquire this or manifest with this disease.
Let me go across to Dr. Chhabra now for more on this situation that has emerged, which appears to be the biggest cluster at the moment in Nizamuddin. Dr. Chhabra, help us understand now, since many of these people have moved to various states, they are being identified. Thankfully, there is a list of people that is available with more states. But considering that they could have been in contact with other people after they've gone back to their states, how is the contact tracing of that going to be done? Will it be a huge task at the moment?
Yeah, you have very rightly said that there's a lot of importance of surveillance and trying to do contact tracing of all these people, because there are more than 2,500 people. 1,500 moved out and 1,000 were still at the markers. So we are not sure how many of them would be infected, but all of them need to be traced. And in addition, also contacts of these people need to be traced. There are examples, for example, of the person from Philippines who went to Mumbai, went to another masjid, and also proven cases there. So these people would be spreading infection because the infection spreads through droplets and contacts from all these people spreading across the country. So it has to be a massive exercise, but that is the only option, because through contact tracing, all these people need to be traced, they need to be kept in isolation, and they need to be tested, and the needful needs to be done in this regard, so that the further spread is stopped and further clusters are not created across the country. So far we had individual local clusters, but now there is the danger of spreading these clusters across the country through these people who are spread across the country. So a massive exercise needs to be done in this regard, and we can't be complacent. We have to take immediate action.
Absolutely. We've seen states also putting out requests that people should self-declare, come to the designated healthcare centers if they have been in contact with any of these people, or they are themselves people who attended the markers. Dr. Mahanta, I want to come to you now. Since the numbers are going up in the country, the flattening of the curve that we so desperately want at the moment is not happening. People are in lockdown. What kind of psychological impact are you already seeing on people, considering that some people are finding it tough, in fact, to be what they believe locked up, although this is the need of the hour?
Yeah, COVID-19, as we all know, it's a very new virus, and it is actually creating a lot of, I would say, stress and anxiety amongst the people all across the world. And you have seen recently also there are quite a few suicide cases that have been reported. And when we talk about anxiety, it is nothing but an irrational fear about the future, which is prevalent amongst population. And quite often I'm getting phone calls from the students, from my friends, and people mentioning me about the kind of stresses that they are experiencing. There is an excessive fear that is predominant in the society as of now. And in fact, when we talk about anxiety, since it is irrational, studies have also shown that only in 5% of the cases such fear turns out to be true, because many a times it doesn't come to be true. So studies have been done in the past as well, where almost 15 countries have been involved, 36,000 participants were involved, and it was found that only in 5% cases such anxieties came to be, actually proven to be true. So I would say that such assumptions should be limited, and people should rely on information from
Correct.
legitimate sources.
Right.
Legitimate sources.
Right, that will help also bring down anxiety, considering that there is effort globally, not just one country making this effort, but globally there's an effort to come up with solutions to arrest the growing infections across the world, and also scientists, researchers working overtime to come up with some sort of a cure for COVID-19. So those aspects should also be kept in mind, so that the anxiety levels again that people are developing at the moment, those can come down. Many thanks, Dr. Chhabra and Dr. Mahanta, both of you, for joining us on our show. Our reporters are going to stay with us. We're taking a very quick break right now. We'll be back with a lot more. Stay right there.